Naturally, lower blood pressure. Let your fork and feet lead the way. High blood pressure, or hypertension, is often referred to as the silent killer. That's because it typically doesn't come with symptoms, yet it significantly increases the risk of heart attack, stroke, kidney disease, and more. But here's the hopeful part. Research has consistently shown that lifestyle changes, particularly what we eat and how we move, can dramatically improve blood pressure. In some cases, they can even reverse hypertension completely. In today's video, we're diving deep into the powerful role that nutrition and exercise play in controlling blood pressure. Whether you've already been diagnosed with hypertension or you're simply trying to prevent it, this information is for you. Understanding blood pressure. Before we jump into diet and exercise, let's understand what blood pressure actually is. Blood pressure is the force that blood exerts on the walls of your arteries as your heart pumps it through your body. It's measured using two numbers, systolic and diastolic. The systolic pressure, which is the higher number, measures the pressure in your arteries when your heart beats. This number reflects how much force your heart uses to pump blood out. A high systolic number often signals stiff or narrowed arteries and is closely linked with heart disease and stroke risk, especially in people over 50. The diastolic pressure, the bottom number, measures the pressure in your arteries when your heart is resting between beats. It gives insight into the resistance your blood vessels offer as blood flows through them. For example, if your blood pressure is 120/80, that means the systolic pressure is 120 millimeters of mercury and the diastolic is 80 millimeters of mercury. Both numbers are important, but for different reasons. High systolic pressure is often a stronger predictor of cardiovascular complications, while high diastolic pressure can indicate that the heart isn't relaxing properly between beats, especially in younger individuals. A healthy blood pressure is usually considered to be below 120/80. Once those numbers rise to 130/80 or higher, it's categorized as high blood pressure or hypertension. Over time, high blood pressure puts serious strain on the cardiovascular system. It can damage arteries, weaken the heart, and increase the risk of serious events like heart attacks and strokes. Globally, more than 1.2 billion people are affected by hypertension, and many of them don't even know they have it. The role of nutrition in blood pressure. Now let's talk about food, because what you eat has a direct and measurable effect on your blood pressure. And it starts with one of the most researched and recommended eating patterns out there, the DASH diet. DASH stands for Dietary Approaches to Stop Hypertension. It's not a fad or a gimmick, but it was developed by the National Institutes of Health specifically to combat high blood pressure. The DASH diet emphasizes whole foods like fruits, vegetables, whole grains, low-fat, dairy, lean meats, nuts, and legumes. It keeps saturated fats, red meats, and added sugars to a minimum. In clinical trials, people who followed the DASH diet saw their systolic blood pressure drop by up to 11 points, often within just 2 weeks. One of the main reasons DASH works is because it drastically reduces sodium intake. Most people consume way too much sodium, often without realizing it, because it's hidden in processed foods, canned goods, deli meats, and restaurant meals. The American Heart Association recommends no more than 2,300 milligrams of sodium per day, and ideally, we should aim for 1,500 if we're trying to lower blood pressure. Another key mineral is potassium. Potassium helps your body balance out sodium levels and relax blood vessel walls. Foods rich in potassium include bananas, spinach, sweet potatoes, beans, and avocados. Getting enough potassium, along with magnesium and calcium, can have a noticeable effect on your numbers. Now, let's talk sugar. Most people don't connect sugar with high blood pressure, but they should. A diet high in added sugars, especially from sodas and processed snacks, contributes to weight gain and insulin resistance, both of which are linked to elevated blood pressure. In fact, a 2014 study published in Open Heart suggested that added sugars may play a bigger role in hypertension than sodium does. And don't forget about coffee. It contains caffeine, which can cause a temporary spike in blood pressure, even in people without hypertension. This effect is more noticeable in those who aren't regular coffee drinkers. However, in people who drink coffee regularly, the body may become less sensitive to caffeine's effects over time. If you have high blood pressure, It's wise to monitor how coffee affects you personally and limit intake if needed, usually no more than 1 to 2 cups a day. How about alcohol? Drinking alcohol in moderation might not be harmful, but excessive alcohol intake can raise blood pressure significantly over time. Regular heavy drinking interferes with how the body regulates blood pressure and can also lead to weight gain, which adds to the problem. Drink no more than 1 standard glass a day for women and 2 for men, or avoid alcohol altogether if you're managing hypertension. Another key factor to consider is the type of fats you consume, particularly monounsaturated fats. These are the heart-healthy fats found in olive oil, avocados, almonds, peanuts, and other nuts and seeds. Studies show that diets rich in monounsaturated fats can help improve blood vessel function, reduce inflammation, and even lower blood pressure when used in place of saturated fats or refined carbohydrates. One study published in the journal Hypertension found that people who consumed extra virgin olive oil daily as part of a Mediterranean-style diet had significantly lower systolic and diastolic blood pressure compared to those who followed a low-fat diet. The antioxidants and polyphenols in high-quality olive oil appear to help relax blood vessels and support overall vascular health. So, choosing the right oils, like extra virgin olive oil for cooking or salad dressings, can be a small change with big cardiovascular benefits. Consuming food fibers is also another effective method to lower your blood pressure. Dietary fiber improves blood vessel function. Soluble fiber like that in oats, beans, apples, flaxseed helps regulate cholesterol and improve endothelial function, which can lower blood pressure. It also reduces systemic inflammation, which is linked to hypertension. Besides lowering blood pressure, dietary fiber will also improve weight management. Fiber increases satiety and helps in maintaining a healthy weight, which is crucial for blood pressure control. Also, foods high in fiber help keep blood sugar levels steady, which makes your body respond better to insulin, and that can help lower blood pressure. The best fiber sources for controlling blood pressure include oats and barley, rich in beta-glucan, legumes, lentils, beans, chickpeas, fruits, apples, pears, citrus, berries, vegetables, broccoli, carrots, sweet potatoes, and seeds, chia, flaxseed. Clinical studies and meta-analyses have shown that increasing daily fiber intake, especially 25 to 30 grams per day, can reduce both systolic and diastolic blood pressure modestly. The effects are even better in people with hypertension or those overweight. The link between body mass index and blood pressure. BMI stands for body mass index, and it's a simple calculation using your height and weight to estimate body fat. A BMI of less than 18.5 shows that you are underweight. If you have a normal weight, your BMI stands at 18.5 to 24.9. An overweight person has a BMI of 25 to 29.9. Obesity has different classes of BMI. For example, Class 1 obese is 30 to 34.9. Class 2 obese is 35 to 39.9, and Class 3 obese is greater or equal to 40. But what is the impact of BMI on blood pressure? High BMI, especially overweight and obese categories, is strongly linked to higher blood pressure. Excess fat, particularly deep abdominal fat, can narrow blood vessels, increasing resistance and making the heart pump with more force. Inflammation and insulin resistance from excess weight contribute to vascular damage. Hormonal changes, like increased leptin or cortisol, can affect how kidneys regulate salt and fluid, raising blood pressure. The good news is that even a small reduction in BMI, losing 5 to 10% of your body weight, can significantly lower systolic and diastolic pressure, improve cholesterol and blood sugar, and reduce overall cardiovascular risk. The role of exercise. Now let's shift to movement, because physical activity is one of the most effective and natural ways to lower blood pressure. Here's how it works. When you exercise, your heart gets stronger. A stronger heart can pump more blood with less effort, which reduces the pressure on your arteries. Exercise also helps reduce stress hormones and improves blood vessel flexibility. One of the biggest benefits of exercise is that it increases the body's production of nitric oxide, which helps dilate blood vessels and improve circulation. This means smoother blood flow and lower resistance inside your arteries. So, what kinds of exercise are best for blood pressure? Aerobic exercises are the most effective. We're talking about walking, jogging, cycling, swimming, or dancing. These activities consistently lower both systolic and diastolic pressure. Just 30 minutes a day, 5 days a week, can lower systolic blood pressure by 5 to 8 points. Strength training is also beneficial. Lifting weights or doing resistance exercises helps manage blood sugar, builds lean muscle mass, and contributes to healthy body composition, all of which play a role in regulating blood pressure. A meta-analysis published in the journal Hypertension found that resistance training could lower blood pressure by an average of 3 to 6 mm of mercury. And finally, don't underestimate the power of stretching, yoga, and mindful movement. These activities help reduce stress and activate the parasympathetic nervous system, which promotes relaxation. Yoga in particular has been shown to lower blood pressure, especially when combined with deep breathing techniques. The power of combining both, while nutrition and exercise are each powerful on their own, they're even more effective when combined. Together, they help you lose weight, reduce inflammation, improve cholesterol, stabilize blood sugar, and support vascular health. And remember, you don't have to do it all at once. Small, consistent changes over time are what matter most. Swap out salty snacks for fresh fruit. Add a short walk to your daily routine. Prepare more meals at home. Build habits that stick. Final thoughts and action steps. To wrap up, here's a quick checklist for naturally lowering your blood pressure. Follow the DASH or Mediterranean-style diet. Cut back on sodium and added sugars. Eat more potassium-rich foods. Exercise regularly, especially aerobic activity. Drink alcohol in moderation, or not at all, and coffee 1 or 2 a day. Reduce stress through yoga or meditation. Monitor your blood pressure consistently. High blood pressure isn't just a number. It's a signal from your body that it's time for a change. But the good news is that change is possible, and it starts with what's on your plate and how you move each day. As always, this video is meant for educational purposes and does not replace medical advice. Be sure to speak with your doctor before making significant changes to your diet or exercise routine. If you found this video helpful, make sure to like, subscribe, and share it with someone who might benefit. Take care, stay active, and take control of your health, one step at a time.